I have to tell you something that has been eating at me for years, and I know that the moment I say it out loud, some of my colleagues are going to be quite upset. But after more than 20 years in medicine, after observing what happens to people when they follow every single recommendation thrown at them, I can no longer remain silent. I am Dr. Ben, and here is what no one wants to admit. Sometimes the worst thing you can do for your health is to undergo too many tests, especially after the age of 60 or 65. I can already hear you thinking, wait, isn't a doctor supposed to tell me to check everything? Isn't prevention exactly the point? And yes, that is exactly what we've all been told. Detect it early. Find the problem before it becomes serious. Stay on top of everything. That is the message we hear everywhere. But what if I told you that this message leaves out the most important part of the story, the part about what happens after something is found? Because here is what those health checkup commercials don't mention. Once something is found, anything, even something that would never have harmed you, the gears start turning, and sometimes those gears crush your quality of life. So today I am going to present 4 medical exams that I see causing more problems than they solve, particularly in people over 60. I'm not doing this to drive you away from doctors. I'm doing it because I want you to understand what you are signing up for before you say yes to every test offered to you. Before getting into the details, I need to explain something that changed the way I practice medicine. It's called the Cascade Effect, and once you see it, you can't ignore it. Here's how it works. You take a screening test. Let's say you feel perfectly fine. You're living your life, minding your business. The result comes back and shows something. Maybe a spot, maybe a shadow, maybe a number slightly outside the normal range. This anomaly could be totally harmless. It might have been there for 20 years and could stay there for 20 more without ever bothering you. But here's the problem. The doctor sees it and now must do something. Because what if they don't? What if it turns out to be serious? So they send you to a specialist. The specialist orders another, more detailed test. That test might show the same thing, still unclear. So now we're talking about a biopsy, a medical procedure, or even surgery. And each of these steps carries risks: infection, bleeding, complications, anxiety, loss of time. And here's the kicker. At the end of it all, 9 times out of 10, we discover it was nothing, that it was never going to hurt you. But you've gone through months of worry, undergone procedures, perhaps suffered complications, and you are worse off than when you started. All because of a test you might never have needed to take. That is the cascade, and it begins with a single, perhaps unnecessary, exam. Let's talk about the first test that causes this problem over and over again. This one is tricky because it seems so smart, so modern, so preventive. I'm talking about full-body scans, MRIs or CT scans of the entire body that promise to check everything at once. You've probably seen the ads. Come in, we'll scan you from head to toe. We'll detect everything before it becomes a problem. It sounds great, doesn't it? The idea of having a complete picture of what's going on inside you, of having control, is incredibly seductive. I truly understand. But here is what really happens. Let's say you're 65. You feel good, you're active, you have no symptoms. You decide to get this scan just for peace of mind. You go in, lie in the machine for 30 minutes, and a few days later, you get your results. And there, in the report, the radiologist mentions something. A small nodule in your lung, 3 millimeters, about the size of a pencil eraser, or maybe a cyst in your kidney, or a spot on your liver. The report says, follow-up imaging recommended in 3 to 6 months. How do you feel at that moment? You walked in feeling healthy, and you walked out learning there is something in your body that needs to be monitored. You probably can't think about anything else. Every time you take a deep breath, you think of that lung nodule. Every time you feel a twinge in your side, you think of that kidney cyst. So 3 months later, you go back for another scan. Maybe the thing is still there, maybe slightly larger. It's hard to tell. The radiologist recommends seeing a specialist. The specialist wants to be thorough, so they recommend a biopsy. And a biopsy is no small thing. It involves anesthesia. It involves sticking a needle into your lung, your kidney, or elsewhere. It involves a risk of infection, a risk of bleeding. And here is what the research shows. When we scan healthy people over 60, we find something unusual almost systematically. I'm not exaggerating. We're talking about 90 to 95% of people. Small spots, small cysts, small shadows. The medical term for these is incidentalomas, things found by chance. And the vast majority of them, truly the overwhelming majority, will never cause a problem. They are simply the marks of a body that has existed for 6 or 7 decades. They are like wrinkles on the inside. But once they are found, they can no longer be ignored. And that is where the cascade begins. There are studies on this subject. They followed people who had these full body scans. And do you know what they found? The people who were scanned did not live longer than those who weren't. They didn't avoid disease, but they did have significantly higher rates of anxiety, depression, and unnecessary procedures. The scans didn't make them healthier, they made them sicker. So, what should you do instead? Because I'm not saying don't pay attention to your health. I'm saying pay attention to the right things. Rather than looking at images of your organs, focus on how your body actually functions. Can you walk up 2 flights of stairs without being out of breath? Can you get up from a chair without using your hands? How is your balance? How are you sleeping? These functional indicators tell us much more about your health than any scan. If you want a real health checkup, sit down with a doctor who will take the time to care for you. Someone who will review all your medications, because I guarantee you that at least one of them is probably doing you more harm than good. Someone who will talk to you about your diet, your activity level, your social connections. Because those things, the mundane things of daily life, are what truly determine your state of health. The scan looks for problems that might not exist. Functional evaluation optimizes the health you already have. Big difference. Let's move on to the second exam. And this one affects a lot of people because it concerns the fear we all have as we age. I'm talking about brain MRIs for mild memory problems. Here's the scenario. Maybe you're in your mid-60s and you've noticed that sometimes you can't remember the name of that actor you like, or you walk into a room and forget why you went there. Normal things, the kind of things that happen to everyone as they age. But maybe your children are worried. Maybe they've heard about Alzheimer's and they're scared, so they push you to get a brain scan just to check. And I understand that fear, truly. No one wants to think about losing their memory, about losing themselves. But here is what I need you to understand. Getting a brain MRI for simple forgetfulness is almost always useless and often harmful. Because here is what happens. You get the MRI, and a few days later, you're at your doctor's office reading the report. And that report says things like mild brain atrophy, age-related changes, white matter lesions, small vessel disease. These words sound terrifying. They seem to indicate that your brain is degrading. But here is the truth. These results are completely normal for someone in their 60s or 70s. They describe what any brain looks like at that age. It's like taking a picture of your skin and being surprised that it shows wrinkles and age spots. Of course it does. That's what skin looks like at 75. The problem is that these medical terms don't sound normal. They sound like a disease. And suddenly, you're walking around thinking you have brain damage, that Alzheimer's is just around the corner, when you're actually doing fine. And here is the really frustrating part. Studies show that when we scan the brains of healthy people over 75, more than 90% of them have results that look abnormal on the report. More than 90%. But most of these people have perfectly normal memory and thinking. The images do not match reality. I've seen people sharp as a tack, reading books, managing their finances, doing crosswords, whose MRIs looked terrible. And I've seen people with early dementia whose MRIs looked almost normal. The image doesn't tell us what we think it tells us. So, what should you do instead? If you are worried about your memory, there is a much better way to check. There are simple tests we can do right in the office, tests that take 10 minutes. We ask you to remember 3 words, to draw a clock, to count backward from 100 by sevens. Simple things that actually measure how your brain is functioning, not just how it looks. And if those tests show a problem, then we start looking for the causes. And here is the important thing. Most causes of memory problems in older adults are reversible. It could be a medication that's clouding your mind, a vitamin B12 deficiency, or depression, which often manifests as memory issues in seniors. It could be sleep apnea, cutting off oxygen to your brain at night, or a thyroid problem. We check all of that first, and you would be amazed at how often fixing one of those issues completely restores memory without an MRI. We look at function, not images. We treat the person, not the picture. Now, if someone is progressively declining, if they're getting lost in familiar places, if they can no longer manage their money, that's different. Then a full workup is needed, including imaging. But for the everyday forgetfulness that comes with age, an MRI creates more problems than it solves. Let's move to the third exam. This one surprises people because it seems so logical. I'm talking about the cardiac stress test, specifically putting someone on a treadmill simply because they've reached a certain age. Here's the typical situation. Maybe you're 72 and you're going to have a routine surgery. Nothing major, maybe a hernia repair or a knee replacement, and the hospital protocol says that anyone over 70 must pass a cardiac stress test before the operation. So, even if you feel fine, even if you can walk a few miles without chest pain or shortness of breath, they put you on a treadmill. Think about it for a second. If you can walk 2 miles in your daily life without a problem, what is the treadmill test going to tell us that we don't already know? Your daily life is your stress test. You pass it every day. But protocol is protocol. So, you get on that treadmill, and that's where it becomes problematic. Stress tests have a very high rate of false positives in older adults. That means the test says there's a problem when, in reality, there isn't. Maybe because your heart rate doesn't go up like it used to, or maybe because of the medications you're taking, for 100 different reasons that have nothing to do with a dangerous blockage. But once that test comes back abnormal, you are on the medical treadmill. They schedule a cardiac catheterization, meaning they thread a tube through an artery up to your heart to examine the blood vessels. It's invasive, it carries risks, and often when we get in there, we find exactly what you'd expect in a 72-year-old heart. A little plaque, a little narrowing, but nothing that requires a stent or surgery. Nothing that was about to cause a heart attack. But now, you've undergone an invasive procedure, and even worse, you are labeled as a heart patient. You're prescribed a bunch of new medications and the psychological damage is done. Maybe you played tennis before, but now you're afraid to exert yourself. The exam meant to protect you has stolen your confidence and your activities. What is the alternative? Listen to your body. It is the best stress test there is. If you can climb stairs, walk at a good pace, and do your usual activities without chest pain or excessive shortness of breath, your heart is telling you it's doing fine. These are the symptoms to watch for: chest discomfort upon exertion, unusual shortness of breath, dizziness. If you have those symptoms, yes, absolutely get checked out. That is when a stress test makes sense. But if you want to know your future risk, there is a much better tool. It's called a coronary calcium score. It's a quick scan, 5 minutes, no treadmill, no needles, very low radiation. It measures the amount of calcium, hardened cholesterol, in your arteries. The result is a number. 0 means a very low risk of a heart attack in the next few years. A high number means you need to seriously focus on prevention, diet, exercise, maybe medication. But here is the fundamental difference. The calcium score tells you your risk. It guides prevention. It doesn't automatically send you toward invasive procedures. It gives you information to make choices, not anxiety that forces you into interventions. Don't let someone put you on a treadmill just because of your age. Trust what your body is already telling you every day. Now, the fourth exam, and I know this one is going to be controversial. I'm talking about colonoscopies after 75, specifically routine screening colonoscopies when your previous ones were normal and you have no particular risk factors. I want to be very clear. I am not against colonoscopies. They are a fantastic tool. I recommend them starting at age 45 or 50. They prevent colon cancer by allowing us to remove polyps before they become cancerous. If you are in your 50s, 60s, or early 70s and you are overdue for one, get it done. But here is the thing. Every medical exam is a balance between benefits and risks, and that balance changes with age. The benefit of a colonoscopy is preventing a cancer that, if it develops, takes 5 to 10 years to cause problems. But if you are 78 or 80 years old, is that benefit still worth the risks? Because colonoscopies do carry risks, and those risks increase with age. There is the preparation, drinking that horrible liquid that keeps you pinned to the toilet all night and can leave an older person dehydrated and weakened. There is the sedation, which in older adults carries more risk of confusion or respiratory issues. And there is the most serious one, the one that really worries us: perforation, a tear in the wall of the colon. As we age, the colon wall thins. The risk of the scope accidentally puncturing it doubles or triples after age 75, and a perforation is a surgical emergency. It often means emergency surgery, sometimes a colostomy. For an 80-year-old, that kind of operation can mean the end of independent living. Now weigh that risk against the benefit. You are trying to prevent a cancer that would take years to become a problem. If your life expectancy is less than 10 years, the math no longer holds up. You are more likely to be harmed by the colonoscopy than saved by it. That is why most medical recommendations now suggest stopping routine screening somewhere between 75 and 85. This isn't a universal rule. If you have a family history of colon cancer, if you've had polyps before, if you have inflammatory bowel disease, the math is different. But for the average person with no special risk, continuing to get colonoscopies every 5 or 10 years until age 90 probably does more harm than good. What should you do instead? Do you ignore your colon? Absolutely not. You move from invasive screening to smart monitoring. First, pay attention to symptoms. This is crucial. If you notice persistent changes in your bowel habits, if you see blood in your stool, if you have unexplained abdominal pain or weight loss, if you develop anemia, these are red flags. At that point, age doesn't matter. You need a colonoscopy to understand what's happening. Next, bet on the power of diet. It's huge. The best thing you can do for your colon is eat fiber. Fruits, vegetables, legumes, whole grains. Fiber feeds the good bacteria in your gut, and these bacteria produce substances that protect against inflammation and cancer. Eat more lentils, more broccoli, more oatmeal, more apples. This is prevention that benefits your whole body without any risk. The message is, get your colonoscopies when they make sense, up until your early 70s. After that, for most people, it's time to focus on symptom monitoring and a proper diet. So, there are 4 exams that I see causing more harm than good, especially after 60. Full body scans that find problems that aren't problems. Brain MRIs for normal forgetfulness that create abnormal anxiety. Routine stress tests that trigger cascades of procedures. And colonoscopies after 75 that risk more than they prevent. Do you see the pattern? It's always the cascade. One test leads to another, then a procedure, then a complication. And somewhere along the way, we forget to ask the most important question: is this person actually better off? Because here is what I've learned in 22 years of medicine. Health is not about having perfect test results. Health is function. It's being able to do what you want to do. It's enjoying your grandchildren, going for walks, reading books, living your life without fear and without unnecessary medical interference. The goal at 65, 70, or 80 is not just to live longer, it's to live better, with independence, dignity, and joy. And sometimes the best way to protect that is to say no to an exam that is going to send you down a tunnel you don't need to enter. I'm not saying to avoid all medical care, I'm saying to be an informed patient. Ask questions. When a doctor recommends an exam, ask why. Ask what happens if the exam finds something. Ask what the risks are. Ask if there is an alternative. Then, make your decision based on what matters to you. You are the one in charge of your health, not protocols, not computer reminders, not recommendations. You. And the more you understand what you are agreeing to, the better your decisions will be. If this information was helpful to you, if it made you see medical exams differently, do me a favor and share it with someone who could benefit. And if you want more honest conversations about health and medicine, subscribe to this channel. I'm going to keep having these conversations because I believe they matter. Tell me in the comments, have you ever felt pushed toward a medical exam that didn't feel right to you? I read all the comments and I learned from your experiences, just as you learned from mine. Thank you for watching. Take care of yourselves.